Welcome everyone to the ROS Wonders Zoom Meetup, the first one for March. We'll have another one in a couple weeks. Today we're going to talk about our new website. We have here with me to explain or introduce it to you, Amy Parker and Joyce Holting. And we're going to discuss the pieces that we had the primary role in creating. And then on our next session, Janet Freeman-Daly will be here to talk about the pieces that she took the lead on, which are, not surprisingly, the more science-focused ones, or the hard science-focused ones. So I'm going to share my screen, and our goal here is to, not to obviously read you the website, you can do that yourselves, but show you the resources that are available. We tried to create this new website. A lot of thought and work went into this over a year, really, trying to address common questions and resources people sought answers to. And we just want to let you know where to find them, where to maybe refer others who are seeking them. So when these questions come up in our internal private Facebook group, often you can, of course, answer them, but you can also point people to these resources on the website so people become familiar with maybe where to be able to find them at will, so they don't have to rely on coming to the group and hopefully getting an answer, because sometimes people get lots of answers and sometimes questions kind of somehow fall below the radar. So we just want to raise awareness that this resource is out there for folks. And of course, it's an evolving thing. We've spent a year creating this, but it's not set in stone. As we learn more, as we get feedback, we will be, modifying and updating the website, because nothing stands still. So here we go, screen share. Sorry, here we go. So this is the homepage, and I guess we flattered ourselves somehow. It ended up being chosen that the three kind of founders here, Janet, myself, and Tori, were featured as on the homepage, but we have lots of other pictures, and Amy will be taking you through that. But up at the top is really the key to the website here. So for patients, when you hover your cursor over that, it brings up a drop-down menu with all kinds of resources. And the first one here is the guide for patients. Initially, we thought of, I'm going to click on that. We thought of calling this a guide for new patients, but we realized it's not necessarily restricted only to new patients. Sometimes people have been in this game for a while and still have these questions, and we wanted to broaden it. So the way the website is structured is, for every page that we bring up, we have these blocks at the top, and if you click them, they'll go down to the various sections. So you'll see, if you were to click the how to stay calm after diagnosis, it brings you to this next section of the website. So we discuss the definition of ROS1 cancer, which is often a point of confusion. We have guidance on how to consume information, and a common question about inheriting ROS1 cancer. So we try to dispel that concern or myth. Expectations for your healthcare provider, how often you can expect scans or lab blood tests, and advice on managing side effects and stress, which takes you to a whole other page, which Joyce will be discussing in a moment, and some referral links to connect to our community and doctors. And we often field requests for assistance with medical expenses, and that's just unfortunately not something we're able to help with. We we just don't have the funds to do that. So we address that question here. So this is a helpful page, but perhaps even more helpful will be things like our common questions about coping with side effects. So I'm going to click on that page and let Joyce discuss that one for you. So I'll hand it over to Joyce.
Hi, everybody. I'm just going to acknowledge first who did this work. It started with Lisa herself, who I think put together for the old site a review of what to do with crizotinib side effects. That was back when, unfortunately, that was kind of the only game in town. Once other drugs started to get approved and often used, lorlatinib and entrectinib, we kind of wanted to overhaul that site for the new website and add some perspectives from those additional drugs. So I led a team that included the amazing Leslie LaChance and Bridget, who's on with us today. And we basically dug in a couple of different ways. They use their own experience on those drugs, entrectinib and lorlatinib. I think actually Bridget was kind of investigating it from the side because she wasn't yet on entrectinib at that point, and isn't anymore. But we used personal experiences. We also used information from the Facebook page. We just basically ran searches, looked through the history, saw which side effects seemed to be questioned the most, and used some of the experiences that were shared there. We also, of course, had reviewers from the more experienced ROS Wonders, Janet and Lisa, looking at the work that we ultimately put together. And then we had it reviewed by Smarty Pants ROS1 experts. So it's definitely taken from a number of different sides. And where we came down, rather than having, by the way, we also did kind of review the stuff in the tiny, tiny little Pfizer print. So there was a review there as well. Just to kind of go through the content that we came up with after doing that exhaustive process. And I really want to thank Leslie and Bridget for helping me with this. We did a overview. You want to keep scrolling a little bit, Lisa? We kind of put together an overview, talking about some of the perspective people really need about side effects, really acknowledging that each patient is unique. And so we certainly can't give, concrete advice for every patient. All we can do is throw out what's worked for others. We discussed the TKIs that we are going to be talking about, those three. And obviously this is, thankfully, we will over time be able to take a look at some of the other treatments, hopefully, as they become more part of our language and part of our lives. And then we just kind of clustered them. Rather than doing it by drug, we did it by side effects that are often common to all of the drugs: nausea and vomiting, diarrhea, constipation, edema. It's not a completely exhaustive list, I can't say, but it's the most prominent advice for each of these. And again, we certainly won't read these to you, but it's pretty long though, isn't it? And I think up above, we talked about the things that were most common across all of them, like drink water, and please drink water. And then there are side effects that we don't think peer support can really help with. You've got to go into medically managed stuff. And that's more where you're diagnosed with high cholesterol, with liver problems, etc. So my key messages about this site are: it's a living document. We're going to continue to monitor what goes on our Facebook pages, what goes on in the TKI world. And we will kind of continue to review these and update them. So you are helping us with this site really by continuing to bring your problems and questions to the Facebook page. And hopefully we will be reviewing this, every 6 months or something. Is this still accurate? Are there any questions? Cool.
So again,
say you're going to review. I didn't notice, just in passing, there's nothing about specific about the different radiotherapies and so on that we'd heard about with one of the talks. Is there?
There isn't.
Okay.
We focused on the TKIs.
Okay.
And that I have been worried about that. I've been worried about that, and I've been a little worried about chemo, although I think that there is a bunch of stuff out there in the world about chemo side effects and how to manage them.
Yeah.
But I am wondering about the radiation side effects as well, and that does come up on our page as well.
Okay.
So perhaps another section that addresses just that. I would love people who have been through radiation and feel, like it'd be fun to dig in and do some writing or research. My email is, I'll put it in the chat if anybody wants to contact me about that. Lisa, do you see is there any problem with us thinking about that I haven't been aware of?
no, not at all. So yes, and I want to emphasize that, this is all volunteer driven. This whole website was a group effort. So please don't feel like you're not qualified to step forward or anything. We welcome help and contributions, multiple, perspectives, insights, all that stuff. So please reach out to Joyce or any of us if you would like to get involved or feel there's something missing from the website you'd like to see there.
I do think, correct me if I'm wrong, Lisa, this is one of the more popular topics.
Correct.
We've been doing a lot of Google Analytics through a consultant we're using, and I think it gets the most hits. And so it's something that people are really relying on.
Yeah, so just remember where to find this page, just under patients and going down to coping with side effects. So Joyce, were you going to discuss another, I forget which other page you might have wanted to talk about. Was there anything else?
I've got 3, so.
What do you have? What do you?
I have community blog and the donate.
Okay. I mean, I reviewed the clinical trials. I could talk a little bit about it.
All right, we'll click on that.
Whoops.
Sorry about that. Okay, so.
What is really cool about this clinical trials section is that Janet Freeman Daly wrote it twice. She wrote stuff once for patients, talking more about the personal decision to become part of a cancer trial, educating them on the basics of what a trial is and what the language is about. And then she did it for practitioners as well, for your doctor, grounding them in what trials are going on now and what has been learned in past trials. And I absolutely love that approach. I was so proud of us for doing that. I mean, I wasn't proud of myself because I didn't do it, but but I love that approach because it means that you've got a resource for your doctor as well, because the ROS1 world can be new to them. But this particular page, I think we worked really hard on just accessibility. Is the language, understandable? And very much takes the patient from where they're at and what they might be afraid of and what they need to ask.
And just to clarify, so the 4 patients, there's clinical trials here, and then for healthcare professionals, there's this page on clinical trials, which Janet will discuss in more detail. This button at the bottom takes you to that healthcare provider page. So if I was to click on that, we would be under the clinical trials for ROS1 cancer. It's the same link as this, and it is a listing of the actual trials that are open as far as we know, and the drugs that are being studied and such. So it's just a more technical page.
In terms of how you can help, I think that one of the worries that we all have is currency on this, especially, if Janet gets occupied with other things, making sure that this is really up to date and that we're not trying to put too much into this, that we're referring out to the sources that are up to date. That's a big deal. So, I'm just really proud that on the Facebook page, every once in a while, you see others get alert to trials, and posting those things, I think, is really helpful, not just to the Facebook community, but to this website as well.
All right. I will briefly show the Find a ROS1 Physician page. So we've collected ROS1 clinician researchers, which are folks at research institutions that are actually involved in current study on ROS1 cancer. So these are folks, we're all familiar with CAMAGE, but there's maybe a few names you might not recognize. Drillin and Lynn are common doctors we hear about. Dr. O in Southern California, but some of these doctors you might not have heard of. We have some more international folks also here. So it's a list that's a little longer than you might have expected, but then we also have a category down here for ROS1 clinicians. So these are folks at community hospitals mostly, or community centers. So they're not doing research, they're just clinicians treating patients, not just, it's just a different focus for a doctor, obviously. But they have worked with one of the clinician researchers in the above category and are quite knowledgeable, sophisticated, willing to collaborate. So we only have 2 doctors listed here, both of them in Seattle. Seattle seems to do really well at this. Don't know why. Maybe it has something to do with Janet living there. Who knows?
Well, the other one is mine.
Right, and Amy too. But we also have this survey here where if you have a doctor that has collaborated well with Dr. CAMAGE or one of these other clinician researchers above, and you would like to get the word out, or they would, go ahead and fill out this form and submit them. We'd love to populate this with more doctors who are open to collaborating and listening, working together with these clinician researchers, because these doctors can't handle every single ROS1 patient that's on the planet. We really need our clinicians out there in the field getting their good information from the researchers and handling the patients as much as possible locally. So even I do that. I have both a local oncologist and a relationship with a researcher clinician at UCSF, because I just also prefer being treated by a local oncologist. So it's a nice setup to have that flow of information going from the academics and the researchers to the community docs. So just to know that this is out here and help us both populate this section, but also help the doctors know that this is something we want from them. So
I will say that when with my latest progression/pneumonitis thing, we were looking at a remote consult with CAMAGE, and it's expensive, it costs money. And all I did was ask my doctor if he would consult with him. Totally open to it, sent him an email, and they went back and forth for a while. And then Keith actually sent me the entire email chain between them before the next appointment that we met to talk with. So many doctors, I think, are open to it. And it helps if you can point them to a place where there is an expert, because maybe they don't know where to find one.
Don't despair either at this list being so short, because it's my understanding that a lot more have been put into the database, and there's Janet has to do the, reach out to them and make sure that they know that their name is going up online and get permission to do that. So I think this list will be growing.
Correct. Before I hand it over to you, Amy, to discuss the Connect with our community, I quite obviously skipped over this treating ROS1 for patients section. I'm going to click on it really quickly here. Janet did a lot of the work on this page, so that's why I skipped over it, because she will probably discuss it in much greater detail. But again, this is set up similar to the clinical trial setup, where we have a treating ROS1 for patients section, and then we have a treating ROS1 for healthcare professionals section. So on this patient page, it's hopefully more accessible language for people, addressing frequent questions we get either on our Facebook group or often direct emails that we receive from our contact us link on the website. So you might recognize some of these questions, you might have them. So know that this resource is out there. I like this section here, questions for both a newly diagnosed patient and also when your cancer has progressed, some ideas of what you need to be asking your oncologist to get the correct information or helpful information. Treatment options. So this is often discussed in our group, different drugs that are available for first line, second line. So that's what's here. And just to quickly expose you, so on the same page for the healthcare providers, it's much more technical about the science. So it goes even into a treatment algorithm that the doctors can use, which has been, again, vetted by the clinician researchers. We submitted it to several of them to review and incorporated their comments. So there's lots more here Janet will discuss in detail. And now I'm going to hand it over to Amy. And Amy, would it be easier for you to share your screen? Should I stop sharing so that you can?
Yes.
Okay, so I'm going to stop sharing and hand it over to Amy.
I like to drive.
Yes. That's great.
So I get to share with you the community piece of our new website, which really starts on the homepage. We have, if you scroll down, some featured stories of ROS Wonders, and these came from our Feature Fridays that you see posted in our private group. These are the ones that had agreed to allow them to be posted publicly on the public Facebook group and our Instagram. And what we looked for was a key piece of being a ROS Wonder that was different from somebody else. So you'll see mine is about changing treatments, and I actually need to update it because I'm changing again. But the idea that you can change multiple times and it's not the end of the world when one fails and you have to change. Barbell started before TKI, so she's got an interest story that way. Michelle's refers to the support she receives from our group. Victoria's is about being on a clinical trial. And then I know Lisa's on here, and hers is a combination of TKI and chemotherapy. So we wanted a feature that had some kind of thing that was different from each other for these. So each one of these, if you click on the link, you get to read the full story. Then under For Patients, there's the Connect with Our Community, but it's also the same place that you'll go if you click the Our Community button. And this really tells the different ways that you can get connected as a ROS Wonder. So you can read the public Facebook page. That one We don't encourage you to ask your medical questions because it's out there to the public for everybody to see. And we have our private group where, you know, everybody in there has been vetted. They've all filled out the form. We look at it. We make sure that it's actually someone who looks like they have ROS1 and maybe 1 or 2 caregivers that go with it. So it's a little bit more private and secure. We also have a link for information about these Zoom meetups that we're in right now, a link to the newsletter, and how you can show your support with some swag. So like the other pages, if you click one of these buttons, it'll jump down to that section. So you can see the public and the private Facebook groups. One interesting bit is that while we all know about the main ROS1 private group, there are actually other ROS1 groups in other parts of the world. So we've linked those there if we know about them. So if you are in a different part of the world, you can find a group that might be even in your own language, like the one that's here that's conducted in German or conducted in French or conducted in Spanish. So the meetup information is there. There's a subscription form for the newsletter. If you're not already signed up for the newsletter, you could click that and sign up, and then you'll get it when it comes out.
Can I riff on newsletter a little bit?
Sure you can.
First of all, we do expect there's one drafted right now, ready to get out the door. And so that'll be soon. But in this whole hyperlinked world, our newsletter articles often are basically blog things that go on our website. And so our newsletter will kind of push out those links so that to drive people to that website. And those blog entries can be listed, or newsletter articles can again be written by any of you. David Chill and I actually last week have been working on an article about his experience in getting drugs after Medicare. And so, everybody has a different experience, and that's what all of this peer support is about. So our newsletter becomes articles that become part of our website that become part of the blog or whatever. So if that makes any sense.
And I'll just riff on that a little bit further, which is, don't feel like it has to be always based on some very science or medicine focused thing. We have the Feature Fridays where people are welcome to share their stories. I'd love to hear more from you, David, about your writing career. I mean, ROS1ers are people. So sometimes our blogs are very, very scientific focused, especially, that's Janet's emphasis, and she's written many of our blogs, but people like to hear the stories also. So if you have an itch to write a blog post, let us know. We'd be happy to talk to you.
Sounds good.
The last piece on here is where you can order ROS1 swag with our new branding. There are shirts, sweatshirts, mugs, stickers, notebooks, pens, lots and lots of things that Lisa spent some time, bags, designing, a magnet for your car. So when you purchase that on Zazzle, a small portion of your purchase comes back to the ROS1.
There's also, just so you guys know, because it was requested by a few people, I created thank you cards. So if you have donors you want to thank, it's just a nice thing to have. So
Is that live now? Can we go in and purchase?
It is.
Things? Oh, great.
Here, I'll give you the link in the chat. Down here, there is a form. So like Lisa and Joyce have both said, if you're interested in helping contribute either to the blog or the newsletter, or you have something else that you'd like to help us with, there's a contact form here that you can tell us what your skills are, and we'll happily put you to use. And then a link to donating. I am going to show you the donation page just quickly. It has options. So if you send someone here and they choose this one-time or monthly donation, it donates to basically our general ROS1 campaign. It's always open. It always accepts donations. Then there are the personal campaigns. So these are the peer-to-peer campaigns that we urged you to set up during our fundraising push in October and November. And this is where a person sets up a campaign. Actually, I'll click and show you. And so it has a little bit more personalized information. And you can see these are all different people who have set up a personal campaign, and people can donate there, and it still goes to the ROS Wonders. We do have a donate with PayPal set up now. PayPal actually takes a slightly smaller chunk for processing. So if you are trying to send some money in, you might choose that if it's not something you're sending out to your family and friends and you want to have that information in there. And then we actually even have a button for ROS Wonders if they want to create that personal campaign. We do have a gold transparency on GuideStar. So we've been recognized as a nonprofit that is using our funding well. And that is important to some people when they are looking to donate money. So that might be something you can point them to if they're questioning how those funds will be used. The last piece that I want to show you is the blog. And the way this page works is you will see little thumbnails here of each blog as they go up. And as you scroll down, there are lots and lots of blogs. We brought over the old blog posts from the old website. So you'll see lots of them there. And then at the top, right now it's at all posts, but you can actually sort these by different categories. And so let's say I wanted to just look at stories of ROS Wonders. Then it sorts it out and I can just read the blog posts that are on that topic. Patient-driven research. So our cancer model project pops up. So it's kind of nice as things are pushed out, like Joyce said, some of those articles from the newsletter will be pushed out as a blog post. And when that happens, you'll see a new thumbnail tile pop up here that will link you to it. Any questions about the community or the blog or how to set up a personal campaign?
Do you want to, as long as you're sharing your screen, take them through the About Us really quickly, and then
Sure.
we can wrap it up.
So the About the ROS Wonders gives kind of the history of how we were started. And then our mission there, so we're not just about providing factual scientific information, but we do want that community. We are educating about ROS1, and we are looking to fund research. So you can see the three main pieces of our mission on there. See our board members are listed. That's on the team section. In the news is an interesting piece. So when we get a mention in an article, we'll post a link to it here. So you'll see there are some web articles where either I don't think we've written any of these. These are all published somewhere else, and the ROS Wonders are mentioned.
Right, the publications is where we were involved in.
Yeah.
And this is a good reason if you should have, well, I might be speaking out of turn here, but if you should have local press for some reason done about you and your story, that would go up here, right? Amy, we would.
I believe so.
Local, yeah.
Yeah.
But make sure we know about it. And
yeah, we might need a new section for it, but right now we have research journals, oral conferences and presentations. So a lot of the big medical conferences when Janet or Lisa has spoken, those presentations are posted here. And you can, there's a contact button if you want that presentation. So lots of information kind of collected in one spot. The contact page.
oops.
There it goes. So this form, it's linked in a couple other places, like the link I showed you earlier that said contact us if you want to help out. I think it's the same form where you just give us your name, your email, your primary interest. So are you a patient? Are you a caregiver? Are you a researcher? And it's an open box to just tell us what it is, what information you want to share with us or what you're looking for. And of course, the donate link is also there under that about us, because we want to make sure people can find it. This little icon here too, that's our community icon. So if you click that one, you end up back on the community page.